option for our patients with IPF, and being that I'm an IPF warrior, I want to try to help as many patients as I can. So a treatment option, it starts by setting expectations. So again, when I meet with patients with IPF, I tell them about the medication, I tell them about the benefits and some of the side effects and how we can work together to help manage those side effects. Aspirin, that's how you say it. Aspirin, it's a FDA-approved prescription medicine for the treatment of idiopathic pulmonary fibrosis. And again, idiopathic is unknown, pulmonary is our lung, and fibrosis is the scarring of the lungs. So again, before taking aspirin, have that conversation with your doctor. Let your doctor know if you have any liver problems, if you've had any kidney problems, if you're a smoker. Your doctor's gonna educate you about smoking and have you try to quit, have any other medical conditions. And again, we'll leave that part about the pregnant and the breastfeeding alone, because I don't think we have anybody here doing all that. So you want to let your doctor know any condition that you have. You want to let your doctor know every medication that you're taking, even if it's over-the-counter medications or herbal medications. You always want to let your doctor know. So one thing you can do is, like when you go home today, if you haven't already done it, pull out all your medications, write them all down, and make sure you carry them to your doctor, okay? So what does aspirin do? Aspirin may help preserve lung function for patients with IPF by slowing the progression of the fibrosis down. It's not going to reverse anything, so the lung function, like you saw on that lung there, whatever's there, it's not going to change that, but we're going to try to preserve what we have moving forward. Now, with aspirin, there are some side effects, just like there is with every medication. There are side effects. So, some of the two big ones that I always talk to my patients about is, especially patients that live near Virginia Beach, to avoid the sunlight. So if you like to go out on the beach, or if you like to go on your boat, you want to make sure that you're wearing your SPF 50. And if the patients are signed up for a program called Inspiration, the Inspiration program, they send them chapstick. I always say put it on your lips, behind your ear, wear your coolest hat. Like with the football season going on now, choose your favorite team, wear your hat. You want to make sure that you're wearing your sunglasses and you're wearing clothes like long sleeves, and you can actually purchase probably clothes that block the sun. Do you have some of those, Peter? Oh, okay.
I don't have a problem with the sun.
All right. And of course, the smoking, if you smoke and take aspirin, aspirin may not even work at all. So you can't smoke and take aspirin. And again, with the sunlight, you want to make sure that you're wearing your sunscreen. But we should be wearing sunscreen anyway, right? Even when we're out. So 3 key questions that you may be asking yourself, because there were 3 clinical trials done before aspirin was approved here in the United States. And again, it was October 2014, so 2-year anniversary. How many patients remained stable? Did fewer patients decline? And how much lung function was preserved? So those are 3 questions that I'm going to answer for you in the next following slides. And if I'm talking too fast, tell me to slow down. Okay? Okay, great. So looking at this slide here, how many patients remain stable? And as you can see, over to the left side, with aspirin, 23% of patients had stable lung function. So more than twice as many patients that were on aspirin, they remained stable. Versus the patients without aspirin, only 10% of patients had stable lung function. And that was in a 1-year clinical study. More patients who took aspirin had stable lung function, meaning no decline. So they were preserving their lung function compared to people who did not take aspirin. Now, there were also 2 other trials done. And one was a 72-week trial that was just neutral, and the other 72-week trial showed similar results. So there were 3 clinical trials here done before aspirin was approved in October of 2014.
Any question?
Yes.
How many patients were involved?
Over like 1,200 patients were in the clinical trials.
Thank you.
You're welcome. And here in the United States, and worldwide, over 27,000 patients have taken aspirin. So it was approved in 2011 in Europe and then in Canada in 2012. Okay? So again, a treatment option for IPF, the clinical trial data did fewer patients decline. Yes, yes, yes. 15% fewer patients with a meaningful decline. So again, looking to the left, all the way over here, the patients that were not on aspirin, as you can see, 32% of patients not on aspirin versus 17% of patients on aspirin, as you can see the purple there. So only about half as many patients on aspirin had a meaningful decline. And what that means is they were able to preserve their lung function. Does that make sense? So let's talk about lung function being preserved. Again, looking at this chart over here, I always say time is long. Time is long. So at the bottom, the study week, that's 52 weeks. And then over here, as you can see, that's milliliters. So you have patients that were taking aspirin, they're at the very top, if you see the graph, and then the patients without aspirin, they're at the bottom. And as you can see, they're declining. As early as 13 weeks, you can see a difference right there. As early as 13 weeks, you can see a difference. And the patients that stayed on aspirin for an entire year, they were able to preserve more than twice as many patients on aspirin, 193 ml difference, which is almost 200 mLs. And that's a big difference compared to patients that were not on aspirin that had a larger decline. So again, on a one-year study, patients taking aspirin had an average decline of 235 mLs in FVC. And remember we talked about when they check your lung function, they have you take a deep breath and breathe and blow into that spirometer, compared with a 428 ml decline for patients who did not take aspirin. So again, patients that took aspirin for the whole entire year in the clinical trial, they were able to preserve more than twice as many patients, almost 200 mLs of lung function.
Which is almost half the size of this thing.
Yes, yes, yes.
You visualize it, right?
Yes, exactly, Peter. And so that can mean the difference between you winning the best garden in your neighborhood, the best flowers in your neighborhood, versus you letting your flowers die and they not be pretty, right? Or that versus, you know, you going maybe to your daughter's, your granddaughter's recital, dance recital, or maybe going to the folk festival, even though we got rained out. But you want to try to preserve that lung function because, again, we all have goals in here, and we want to be able to do the things that we love to do. And with the fall time coming, and I hear everybody saying that they're able to breathe a little bit better, I'm sure that we have more goals versus being in that hot humidity, right? So, a treatment option again, aspirin. How do you take aspirin? So, I'm going to ask a patient that has IPF in here, Peter or anyone else that wants to volunteer, for breakfast. What did you have for breakfast this morning?
2 slices of bread and some ham.
Okay, sounds good. I hear that protein came in, right?
Yep.
Yes. Now, when I talk to patients and they tell me that they had a cup of coffee and that was their breakfast, that's not going to cut it. You have to take aspirin with a full stomach. So, I always go to support groups and I listen to patients tell me how they're taking theirs. And a lot of patients will say that they eat like half of their meal and then they'll take their pills. Is that what you do as well? Okay. Because you want to make sure that you have a full stomach when you're taking aspirin. And you don't want to just have a piece of toast and a cup of coffee and you consider that a breakfast. Maybe want to mix it with some protein, like you said, ham, maybe have some carbs and some fat. But always talk to your doctor because I always say whatever diet your doctor has you on, they can always help you, or maybe your doctor may refer you to a nutritionist. Here's the dose in here. Week 1, the patients, they take 1 pill with each meal. And then move into week 2, they usually take 2 pills with each meal. And then week 3, they take 3 pills with each meal. But I always tell my patients, you know your body better than anyone else. So always work closely with your doctor and let your doctor know what your body can tolerate. Right? Any questions? Okay, so again, your doctor, he's going to do some blood tests on you. They're going to check your liver like the first 6 months. For the first 6 months, they're going to check your liver function every month, and then moving forward like every 3 months after that. Now, it's up to you to pay attention and look at your beautiful faces in the mirror and make sure that you don't have any skin discoloration, or your eyes are turning yellow, or when you're urinating that you're having that darker tea-colored urine, or if you feel pain in your right upper side where our liver is, or if you bleed or bruise more easily, or if you feel more tired. Again, you are your strongest advocate. I'll be number 2, but you are number 1. So you have to let your doctor know what's going on with your body. Again, we talked about your skin and photosensitivity. I heard Peter say he didn't have any issues with that, but some patients that like to stay in the sun and go on their boats and go to the beach, it's so very important that you wear that sunscreen. And then with your stomach, it's so very important that you have a full meal. Usually with the sun sensitivity, it will go away like the first 6 months, and then with your stomach, patients, they say sometimes it goes on for like the first 3 months, and then it just subsides or kind of levels out. But I can't stress enough to you how important it is to share with your friends or family or anyone that you know that has IPF the importance of eating a full meal. And again, the most common side effects. Feeling tired, we heard that. Well, we heard the shortness of breath, headache, dizziness, and decreased or loss of appetite. Those are the most common side effects. And I spoke with the patient and shared with me that he had lost a lot of weight taking aspirin, and he didn't want to stop taking aspirin because that was the only side effect that he had. So we talked